it's great to see so many people here. As Katie said, I'm from Dorchester. I'm from the Dorset Health Campaign, which is a cross-party group who have been working with the Save, SCBU, Kingfisher and Maternity at DCH, at Dorset County Hospital. Emily Case is here with me from the campaign as well, and hopefully Emily will have a few words to say to you as well. Emily's from Bridport. First of all, just like to say our campaign, the Save SCBU and Kingfisher campaign managed to mobilise enough people for 3 very successful marches in Dorchester. And we had, at one point, we had over 1,000 people on a march through our little town of Dorchester, which just shows the strength of feeling there. And we handed in a petition just at the end of the consultation period. We had 27,000 signatures on that petition. So I think, our campaign has really been successful, but we're not finished yet. We're going to keep going. So we believe that there are serious flaws in the clinical services review. We believe that the assessment of travel times is underestimated and not based on real examples. The current state of the ambulance service, which obviously for us over in the west of Dorset is a really important issue, was not even considered in the clinical services review. So we believe that some disadvantaged groups will be unfairly and negatively impacted. There's not enough evidence that the integrated community models would provide better outcomes for patients or be more cost effective. GPs and NHS workers and counsellors were not properly engaged with or consulted with when these proposals were being put together. So those are some of the reasons we believe that the whole consultation, the whole clinical services review was flawed. As Katie was saying earlier, the review is part of the government's 5-year plan to make 22 billion of cuts. There may be some good ideas in that review about integrated working, but they're not going to work without an increase in funding. And that increase in funding is not coming. It's not coming. This government have said no, there will be no more money for the NHS. It includes relying on community and voluntary organisations and use of private care home beds. And I think this is just one example to show where we're heading, where they are heading with this, and that is more privatisation in the NHS. And that's something that we oppose. So here are a few things that we think would make a difference to the NHS in Dorset. The problems with recruiting doctors and nurses over in the west of Dorset could be addressed by the following steps: increase funding and integrate health and social care, reinstate the bursary for student nurses, a fair pay settlement for NHS workers, reduce the heavy administrative burden on GPs, and ensure that Britain and the NHS continues to welcome and support workers from other countries. But was any of this mentioned in the clinical services review? No, none of that was mentioned, and those are all the things that are crucial to the NHS. Okay, so I will just finish off before I let Emily speak. We did a travel survey, our campaign, Dorset Health Campaign, Save SCBU and Kingfisher. We had a travel survey. We had nearly 700 responses to the survey, and every single one of those responses, bar one, said that it would be a disaster for their sick children and their families if Kingfisher ward was closed. The children's ward in Dorchester was closed, the maternity was closed, and they had to come over here to Bournemouth for those services. They all said that it would be a disaster. But is anybody listening to those parents and those families? That's what we want to know. Is anyone listening to them? I think we'll find out when the CCG make their decisions. And in answer to the question that people put to us all the time, don't we need to make some cuts? Because it's just not sustainable, is it? We need to make some cuts. Well, what I would answer to that is that the government have said there'll be no increase in funding for the NHS, but this is a political decision. The NHS needs an increase in funding every year to keep up with inflation, but this government is cutting funding. So that's why the NHS in Dorset is cutting beds. We have a choice, we have a chance with the coming election to make a choice about whether we want a government that will give the funding it needs, give the NHS the funding it needs, or a government that's starving it of funds so that private health companies can take over. I think it's a clear choice. And thanks for listening. And Emily, do you want to have a word?
Hello, everyone. I'm here as a sort of last minute, really. I feel so passionate